Welcome to a compelling medical case study exploring a medical mystery, a case of painful hepatomegaly and ascites. Our case begins with a 36-year-old woman entering the clinic, visibly uncomfortable, reporting 3 days of constant right upper quadrant pain. This was not the intermittent, colicky pain often associated with gallstones, but a steady, unrelenting ache accompanied by a distended abdomen. She had no history of liver disease, alcohol use, or drug abuse. Her only medication was a combined oral contraceptive pill. Her vitals were stable, but examination revealed a tender, enlarged liver edge and shifting dullness, confirming ascites. Initial labs showed mild elevations, AST 138 and ALT 152U/L, not the dramatic increases seen in viral hepatitis or drug-induced injury. So, what was causing this tender, swollen liver and new-onset ascites? The diagnostic detective work began. The team first considered viral hepatitis, which seemed plausible given the acute hepatic tenderness and mild transaminase elevation. However, hepatitis typically presents with malaise, jaundice, and transaminase levels in the thousands, none of which our patient exhibited. Alcoholic hepatitis was also ruled out. Her AST, ALT ratio was close to 1, not the typical 2-to-1, and she denied alcohol use. Congestive hepatopathy from right heart failure or constrictive pericarditis was considered, but her JVP was not elevated, lungs were clear, and no peripheral edema was present. Malignant or infiltrative diseases like hepatocellular carcinoma or metastases could enlarge the liver and cause ascites. Yet, there was no weight loss, fever, or focal lesions on early ultrasound screening to support this diagnosis. Biliary obstruction, such as gallstones or cholangitis, was also a possibility, but her pain wasn't colicky, and there was no jaundice. A sharp-eyed resident then noticed a crucial detail: the oral contraceptive pill. Combined OCPs are known to promote hypercoagulability, leading to a new line of reasoning. Could this be a vascular problem? Painful hepatomegaly, ascites, and mild transaminase elevation strongly suggested hepatic vein obstruction. The attending physician promptly ordered an abdominal Doppler ultrasound, bypassing CT and HITA scans. Within minutes, the mystery unraveled. The Doppler showed absent flow in the hepatic veins and collateral channels forming around the occlusion. The diagnosis: Budd-Chiari syndrome, a thrombotic obstruction of hepatic venous outflow, causing hepatic congestion, hepatomegaly, and ascites. In Budd-Chiari syndrome, a thrombus or external compression prevents venous drainage into the inferior vena cava. This leads to blood backing up in the liver, causing sinusoidal congestion, hepatomegaly, increased portal pressures, and ultimately, ascites. The caudate lobe, which drains directly into the IVC, often hypertrophies in compensation, a classic radiologic clue. Risk factors include hypercoagulable states like polycythemia vera, myeloproliferative disorders, pregnancy, and oral contraceptives. Initial treatment involves long-term anticoagulation to prevent further thrombosis. If hepatic congestion persists, angioplasty or TIPS, a transjugular intrahepatic portosystemic shunt, may restore venous flow. Severe cases with liver failure may ultimately require transplantation. For clinicians, remember to think vascular when encountering painful hepatomegaly, ascites, and mild LFT elevation. Oral contraceptive pills can be a subtle yet deadly clue pointing toward Budd-Chiari syndrome. Abdominal Doppler ultrasound is the diagnostic test of choice, quick, non-invasive, and highly sensitive for venous obstruction. Remember the caudate lobe hypertrophy as a compensatory hallmark, and that early recognition and anticoagulation can prevent progression to hepatic failure. Our patient's anticoagulation was started promptly, leading to improved ascites and subsided discomfort within weeks. Her oral contraceptive pills were permanently discontinued, underscoring the importance of medication review. This case reminds us, when the liver hurts, but the enzymes don't scream, listen to the veins.